International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
My name is Afari-Asiedu, a research fellow and a sociologist with the Kintampo Health Research Center, one of the research centers under the Research and Development Division of the Ghana Health Service. In this video, I will be talking to you about a study we conducted in the Kintampo North and South Districts of Ghana entitled Volunteering for Health Services in the Middle of Ghana, in whose interest, published in the International Journal of Health Policy and Management in May 2018. Calls for innovative approaches that address insufficient health workforce challenge, particularly in low and middle income countries, have resulted in a resurgence of various countries' interest in community-based volunteer programs that is expected to extend healthcare coverage and key interventions to hard-to-reach communities. In Ghana, the community-based health planning and services is one of such programs. In this program, community-based volunteers assist community health officers in health promotion activities, vital events recording, community mobilization for health activities, disease surveillance, and the provision of basic health services. Community-based volunteers are not paid and are lay members of communities who work in association with the healthcare system in mostly rural but in some urban settings. Using the social exchange theory as a framework, a mixed method cross-sectional study was conducted to examine the motivation among volunteers working on health-related activities in Kintampo North and South Districts of Ghana between December 2014 to February 2015. The social exchange theory contends that individuals act on the basis of rational considerations by weighing the consequences of alternative lines of conduct in terms of the benefits they are likely to generate. In this study, we found that personal interest in the form of recognition by community members and health workers, and also the selection of these volunteers by community leaders, were initial reasons for volunteering. As some of the volunteers put it, we feel we are doctors, and this is because of their association with the health system. Monetary incentives, such as allowances for extra duties and per diem for travel and accommodation during trainings outside volunteers' community, and non-monetary incentives such as t-shirts and bags meant for their work and social prestige emanating from their recognition, as well as preferential treatments given to these volunteers when they attend health facilities, were facilitators of volunteers' retention. There was, however, a weak evidence to suggest that per diem for travel and accommodation was a reason for volunteers' satisfaction. The behavior of these volunteers was therefore in line with the principle of social exchange theory, having been motivated on the basis of some benefits that they were likely to derive. Considerably, their behavior is therefore a function of its payoff, whether monetary or non-monetary. We therefore encourage organizations that engage community-based volunteers to strengthen the selection of volunteers in collaboration with community leaders, and to provide monetary and non-monetary incentives to motivate volunteers. Thank you.